Shani Banani, and I greet you in the powerful name of my Lord and Savior Jesus Christ. Welcome to our 12th Mnemonic in Internal Medicine. We're breaking down Peripheral Neuropathy. What do you call it when a backpack messes up your spine? You call it scoliosis. And what do you call an Egyptian who adjusts spines for a living? You call him a chiropractor. So guys, let's just break this down. In peripheral neuropathy, the varied etiologies can take the form of stare gland. So first up is sarcoidosis. Now with sarcoidosis, we know is a multisystemic infiltrative disorder, and you must look for clues like bihilar lymphadenopathy on the chest x-ray, erythema nodosum, peripheral arthritis, and that triad speaks specifically to Lofgren syndrome, which is relatively specific for sarcoidosis, so much so that you don't even need a tissue biopsy to make the diagnosis. Also be aware of manifestations like heart block, hepatosplenomegaly, which speak to reticular endothelial system involvement, anterior uveitis, uveal parotid fever, and on your bloods, hypercalcemia and a raised SACE level, which is serum angiotensin converting enzyme level. Thyroid disease, both hypo and hyperthyroid, can cause peripheral neuropathy. So on your history taking, you must be aware of things like heat or cold intolerance, change in the appetite, weight change, change in the skin, hair or voice, change in bowel or menses. And of course, do your thyroid function and look for features of thyroid disease. Amyloidosis is another beautiful infiltrative systemic disorder with manifestations that are varied, including proteinuria and organomegaly. And the key thing there is that you're going to find apple green birefringence on Congo red staining on tissue histology. Guillain-Barré syndrome, we know, is AIDP, Acute Inflammatory Demyelinating Polyradicular Neuropathy, and we discussed this in our, I think it was the algorithm we did a couple of days ago. The 5 A's of GBS. Lead poisoning, as we know, clues to lead poisoning causing peripheral neuropathy include a microcytic anemia. Right? Clinically, these patients have blue gums, right? Very weird, as well as basophilic stippling on the cytoplasm of your red cells on smear. Alcohol. Other manifestations include cerebellar involvement, Wernicke-Korsakoff syndrome, beriberi, and a clue on your LFT is that your AST to ALT ratio is greater than 2:1. You might have an isolated high gamma glutamyl transferase and macrocytosis on your smear. Nutritional causes of peripheral neuropathy, mainly your B vitamins, right? So thiamine deficiency, B6 deficiency, especially in the setting of isoniazid-induced drug toxicity, right? And B12 deficiency. Now, B12 deficiency, I put an asterisk here because this can manifest with another clinical feature that corresponds to a mnemonic called 2 P's in a pod. The 2 P's being pyramidal tract involvement and posterior column involvement. POD speaks to P for peripheral neuropathy, O for optic atrophy, and D for dementia. And the classic seller for B12 deficiency is a patient who has brisk knee reflexes bilaterally with absent planters. Why do they have brisk knee reflexes? Because of pyramidal tract involvement. Why do they have absent planters? Because of peripheral neuropathy. So that combination speaks to B12 deficiency as well as tabes dorsalis. Okay, diabetes manifests with a plethora of neurological manifestations, including motor, sensory, and autonomic dysfunction, notably erectile dysfunction, postural hypotension. Also, don't forget mononeuritis multiplex, diabetic hemorrhaphy, and the diabetic third nerve pupil, which is pupillary sparing. Drugs as well, especially isoniazid we mentioned. I put a red dot next to alcohol, nutritional, and diabetes because these three are very common and cause commonly a sensory neuropathy, all right, versus causes of predominantly motor neuropathy, which include Guillain-Barré, botulism, lead toxicity, porphyria, and hereditary sensory motor neuropathy. So also don't forget your hereditary neuropathies. All right. God bless. Have a wonderful day.